patient engagement today is one of the key parameters on how to grow your healthcare practice for all the doctors and healthcare providers, right? And we talk a lot about patient engagement in healthcare, but the reality is it's not about the patient engaging in healthcare. What as a doctors or healthcare professionals we want is patients to take action towards their own health and being integral part of the healthcare, right? So with that, today's patients or so-called as consumers expect more from every relationship they are. And of course, healthcare becomes one of the key areas where they want to engage in. And even healthcare system has a deep drive and a need to increase the loyalty, increase revenue, and increase healthcare outcome. With this all keeping in mind, so let's look into how can we engage our patients better and drive loyalty, revenue, and better outcome through this process, and what is the practical application of this. For which, let's look into the mind map. So let's look into the patient engagement, which is one of the key parameters on how to grow your healthcare business, right? So under patient engagement, we have three components which we'll be looking at today, right? That would be challenges, strategies, and action steps. Okay, so under the challenges, so let me show you what we are going to look into. So under the challenges, we have patient side challenges and a doctor side challenge, right? And we have under patient side challenges, we're looking to 4 points, and doctor side challenges, we're looking to 4 points. Okay, and apart from that, in strategies, we'll be looking into around 6 points on what are the strategies, 6 steps or 6 points on which we'll be looking into. And action steps, what are the 6 steps again to take action, and also finally what is the fast track way, how can you implement this very fast and effectively to increase and engage your patient in your current daily practices. For clinics, hospitals, the bigger hospitals, physiotherapy, or any healthcare center you have, everything applies for the same. Okay, so let's now take one by one. So first, let's look into the challenges in patient engagement. So in the challenges, we have two sides, that is, one is patient side challenges and another one is the doctor side challenges. First, let's look at the patient side challenges. Okay, in the patient side challenges, the first one is patient cultural background. So based on the cultural background of the patients, so either the language could be one of the great barrier of interacting, and also a patient may not be feeling comfortable to interact with the patient, with the doctor, because of the barrier of language or other cultural barriers. Okay, which has to be which is one of the key which you have to look into, which will be also taking action towards it. So patient education level, very important. As you know, most of the patients who are coming to you could be well educated, but still there are a part of percentage of patients who are coming to you may not be well educated. So for them, or even with the well educated people, being healthcare as a very complex thing, it will be not easy to comprehend whatever we are telling. So not able to understand their treatment recommendation is also one of the key areas of challenges of patient engagement. Next is cost consideration. When it comes to cost, a lot of decision making changes. So patient engaging in the healthcare also depends, and they may move on to the different healthcare services, okay, alternative healthcare services. Next is patient motivation. So what is the key part of patient motivation? That is, attitude of the physician sets the tone. What does I mean by that? Okay, if the doctor conveys that I make the decision attitude, the patient will revert back to the passive role, right? So what we want now is patient to be on the forefront, taking active role in their healthcare process, right? But if the physician tells that I tell everything what you have to do, then the patient sits back, lays back, and takes a passive role. So that's what we want. We want them to be actively involved in the patient in the treatment process, right? So those are the 4 things: patient's cultural background, patient education, cost consideration, patient motivation, right? That's the patient side. Let's now look into the doctor side of the barriers. One is lack of modern technology, right? So basically we have not been trained in these areas. So what is lack of modern technologies? That is, currently how we are interacting and engaging with the patient is with pamphlets, posters, notice boards, printables, and these produce very suboptimal results. Okay, so these are traditional methods, and what we lack now today is using the digital tools, the new tools which are existing, where either having a website or effective website or portal, not just a website portal, right? And smartphone apps which can be used, digital displays in the waiting room like having a TV screen, smartphone information, smart patient information screens, all this can be adopted, but do you have this, right? This is one of the challenges what we are currently having from the doctor side. So technology, one of it. Lack of training. So what we lack, so of course one is insufficient clinical training itself, and second is insufficient technology based training also is one of the core area which we are lacking today, right? And lack of time is one of the great reasons we give for every solutions which may have been in front of us, right? One is large number of diverse strategies that can be employed in engaging the patient. So the thing is that because there are so many methods, we don't have time to implement that. Second is competing priorities of the organization. So you have running your healthcare business, so there may be a lot of priorities how you have to engage in your healthcare practice or to grow your practice. So the time constraint to engage the patients may be not be a priority, right? So lack of time. Fourth one is lack of patient feedback. So if you don't get feedback from patients and not understand what's happening in healthcare and their mind, it becomes very difficult. So lack of electronic patient tracking, and so this becomes better when we do patient tracking through the throughout the decision making process, right? So once we do that, then we get the right feedback and right answers where we have to tackle for what type of problems, right? So this is very important to understand. Okay, so that's what we just discussed of these things. So now let's move on to understand the next. Let me just close this. Okay, so that is the challenges. So these are the challenges which we are currently looking in patient engagement. Let's see what are the strategies we can use to bypass these challenges or to solve these challenges, right? So first is health literacy. So what is health literacy? See, basically as a doctors, healthcare providers, what we have to assume is that all patients are at risk or not understanding the information. This is the first thing what you have to understand. And once we know that every patient, like we understand that every patient has a difficult to understand, then we have to use alternative methods to make them understand, like videos, illustrations and diagrams. And currently in this 20th century, videos are playing a great role, and unless you engage your audience with the patients with videos, it's a key area which you're missing, right? And the next one is patient involvement. So patient involvement, in the patient involvement we have 4 things. Give patient a chance to say their opinion, make patients feel that they have a stake in things and being proactive, make them feel that their need and preferences are understood. So by doing all this, what happens is the patient gets informed, and the informed patients gets actively involved in decision making process of its care and treatment, and this established a great trust in the clinicians, and that's a wonderful thing and the space to be in, right? So that's what we looked into, patient involvement. And then what we look into is digital health. So what is digital health? So first, give them an easy access to use patient portal. Okay, get them. So even the patient is not currently on a digital platform, now everyone uses a digital platform, like we have a smartphone, right? So why not get them to the digital platform, and also offer training on their proper usage, how to get to you when they have a problem using phone is what you have to train them, right? And I'm not talking as a doctor, you can have a receptionist or someone who can train it, and with just 2-3, it just takes 30 seconds to tell them how to approach you through an online portal, right? So that you can do easily. The fourth one is community or peer support. So it becomes very important to have a community and peer support, because healthcare is overwhelming. We have a lot of challenges people face with the simple things, and they just want simple answers for those. And when patients are having life altering illnesses, like even diabetes is a life altering illness, right? So they require a great support. And what happens by building a online community, I'm talking about online community, where we can create a community of our own. As a doctor or healthcare provider or a hospital, you can have your own digital community of your own geographic area, where what is the best of it is they need information and support, and when it comes from someone who has been there, it can be especially helpful. The next one we'll be looking into is the wearable tech, right? And with the advancement of technology, there are a lot of things, wearable devices have come, smartphones, we have watches, smart watches, which has been using. So why we recommend and tell about this in patient engagement is because one is there are a lot of chronic conditions people are suffering from, so they require daily attention. Second, when you give that suggestion and they consume that suggestion of using a wearable tech, it gives a sense of commitment in their healthcare by using that, and gives a powerful source of information and motivation for them to take part in their own healthcare process. So that's the power of wearable tech. Okay, and then we have online portals. So you have to empower your patients to approach you through online portals, right? To get an online appointment, you can give an online prescription, feedback on treatments, and access to the latest information about their health and healthcare, and engage them in online platforms is a very important. As you know, it has wide variety of advantages. One is, of course, there are a lot of it's help you in cost effectiveness. They don't have to travel and wait and do a lot of things when they can approach you through an online process. It's a very important thing which we'll be discussing that later in more detail. Okay, now coming to we looked into what are the strategies. One is health literacy, patient involvement, digital health, community and peer support, wearable technology, and online portals. The 6 things which we discussed as a strategy. How can you do it? Now the question is how to implement this, right? Very easily. And these are the action steps what you have to do. The first action step is self-assessment. First, self-assess where you stay in the patient engagement. How are you engaging with the patient? Are you using these tools? Are you effectively engaging, right? If at all you're not, or if you're feeling short of it, set a goal what you want to engage and how much you want to engage and what is that you want to get outcome out of it, and create a plan of engagement for either diabetes, hypertension, pregnancy, or arthritis, or any disease, or healthcare, obesity, healthcare problems, diet, anything you have. Create a plan for how you want to engage them in, and have a system and tools. So what I'm talking about, you don't have to do all this. What are we just talking about? Some information, knowledge. So theoretically, no, you may have to do this I understand time is one of the main concerns for doctors and healthcare professionals. So you may spend 10 to 15 minutes with each patient. In that time duration, how can you engage with so much of engagement process? So don't have to worry. With current digital age, you can automate most of your process of engagement, and also you can do a group engagement, getting all your patients to at one roof. How you do online, how do you camps offline and engage with patients. You can do the same type of online camps and educate, engage, and answer their question at one shot. In 1 hour, every engagement is happening, and we'll discuss that more in strategies later. Okay, and see an action routine. How often do you want to engage and do this engagement activity with the people, and you can put that in automation with the digitalization, and it just does work for you, and you don't have to lift a pen, right? And then finally analyze and scale from the data which you accumulated, so that you can grow to the next level and get more patient engagement, of course, indirectly growing your healthcare business through that, right? And finally, what is a fast track? Like we have discussed everything here. So what you can do, this is what I have told you about all the structures and how can you take the process, right? So before I just tell you let me show you the entire process what we just discussed, right? So we have challenges, patient side, doctor side, all these challenges. We have strategies we discussed, and also I told action steps how you have to take. So but if you want the right process on how we have developed our entire patient engagement model and the different steps of how to grow your healthcare business in the current era, you can just join our masterclass webinar, right, which we do almost every week. So you can just click the link below. So to join our masterclass webinar, how to grow your healthcare practice, right? It's a how to grow your healthcare practice is a masterclass webinar. You can just click the link below and join our webinar, or you can visit our website digitalhealthcarehub.com. Again, let me repeat, digitalhealthcarehub.com. And once you enter the website, you can see a button called as first time visitor. You can click on that and it will take you to the page where you can register for our next upcoming webinar to understand how to grow your healthcare practice in the current digital era. So just to revise, so we looked into the patient engagement. In the patient engagement, we looked into the challenges. In challenges, we have two things, that is patient side challenges and doctor side challenges. Patient side challenges, we have patient cultural background, patient education level, cost consideration, and patient motivation. And then we have four doctor side, that is lack of modern technology, lack of training, lack of time, and lack of patient feedback. And then we looked into the strategies. In strategies, we have health literacy, we have patient involvement, digital health, community and peer support, wearable technology, and online portals. 6. Then we have action step. First, you do self-assessment, set a goal, create a plan, implement the systems and tools for the automation and to make it faster, and create an action routine of weekly, monthly, daily, and yearly thing, so that they can automatically deliver it to them and engage your patients. And then analyze and scale to build your practice and grow your practice to the next level. So but with all these things, you would like to take in fast track mode, what you can do is join our masterclass webinar. Just click the link in the description below, or you can go to our website digitalhealthcarehub.com and join our masterclass. Okay, so with that, I'll see you in the further videos. Till then, see you, take care, have a great health.